The Royal College of Nursing began the SenseMaker project in 2020 to enable us to capture the lived experience of nurses, nursing assistants and students during the COVID-19 pandemic. Using the SenseMaker tool gave the RCN the ability to hear and analyse member stories, thereby giving us a reflection of their lived experience throughout this time. Understanding the experience of nurses and their thoughts on the impact on patients and their ability to care was invaluable to the RCN. It allowed us to identify patterns and to highlight areas of concern using real examples. This helped us strengthen our calls for change with employers, policymakers and politicians. I hope you will find some of the stories which are read out by nursing staff as interesting and thought-provoking as we have.
I have been a nursing assistant working through the pandemic since March 2020. Every day was a different set of rules due to infection control, ultimately to keep us safe, but it was stressful. This week in particular has been busy due to the surge of COVID-19 positive patients. The virus has been so unpredictable. I've had 100-year-olds survive this while younger patients have been admitted to ICU. They tell you not to spend too long in positive patients' rooms because it puts you more at risk. But how can you leave anybody in that state? Nursing during COVID-19 is often putting patients' health before your own.
The last few weeks since this nightmare has started has highlighted the total lack of respect that management in the trusts have for our nursing profession. It has been daily that they ask more and more from our nursing staff. There has been a total focus on claiming glory, looking good in the eyes of the public, forgetting the daily patients and caseloads that we cared for daily prior to this crisis. Some colleagues from other professional backgrounds have been redeployed to jobs that have resulted in failures in the service, impacting on patient care. And it has been ignored in what can only be explained as glory hunting. Nurses are on their knees. Patient care is being impacted.
Since this whole thing have started, nothing has been the same. My home life has completely changed. I haven't seen my family member for at least 8 weeks. My work routine has been turned upside down and I'm not sleeping. The situation is ever changing from the perspective of my work. The plan that is agreed in one day would have changed within the space of 24 hours. I find this very disconcerting and very stressful. As a senior nurse, I'm trying to support my team, but I feel powerless as I can't answer many of the questions they have, neither can I give them the assurance they are looking for. I feel I'm constantly asking them to change, to adapt and be flexible in how they work to meet the needs of the current situation. I feel completely overwhelmed by how much they have all achieved in a short space of time.
I've had a great experience in the last week at work. Although not formally redeployed, I'm working in a vaccine centre for COVID-19. It has both refreshed and re-energised me to be part of such a positive and valuable piece of work. Although I realise this is temporary, I can see the value of good staff relationships, positive leadership and solid systems and processes. I've reconnected with patients and it has been honestly a real joy. I was anxious, but I used my initiative and knew the issue was not my ability and personality, so I got on with the job and looked after the patients who were, after all, my priority.
I have been a nurse for 37 years. I have worked through many challenging, professional and personally difficult times, from the Troubles to COVID. I have never lost sight of the fact that I can make a difference to patients and families and treat them how I or my family would like to be treated. My team and I have been redeployed to the COVID frontline, and I am immensely proud of my team who have relearned old skills, developed new skills, and given 100%. At the end of a shift, my body is tired, but my spirits are high. I am an NHS nurse, and I am proud to say so.
The decision to remove remunerated status from students in England at such a critical time has caused a lot of uncertainty to nursing students across the UK who already feel undervalued. This may not be the kind of thing you're looking for, as I know RCN are already fighting this issue, but it's the most relevant issue to me and my peers. My last week has been filled with so many emotions, from anxiety to uncertainty. As a newly qualified nurse in October, I have now been moved to my 4th area, including ICU, to work whilst dealing with the loss of my much-loved mum at the end of February and dealing with the pandemic. I started on a new ward last week, then I was told I was going to a new one this week. I cried again. I've started this new ward this week, and thankfully no sobbing faces from my normal ward, but I'm grieving. I'm sad and I'm finding things tough, but coming to work and seeing my patients helps. It is just sad that I have to wear a mask and they can't see me smile. Yesterday I had a good day despite spending 20 minutes crying before work. I walked through the ward doors with confidence, and I know I gave my patients the best that I could. I felt content in my work, that I supported their needs and kept their day upbeat and positive. On the outside, it looks like I'm living my best life, happy and bubbly, but off ward and inside, I'm starting to crumble. So today I've made the first step and I'm going to try and get some emotional support.
I felt that as a team and as a nurse that we had accomplished achievable goals during this pandemic, and morale and camaraderie were good. These feelings were rapidly decimated on the receipt of a bulk email sent to all employees, basically chastising us for a lack of social distancing and poor compliance to PPE. It was like a hard kick in the stomach at a time when supportive, encouraging words would have had more of a positive impact. Apparently, staff felt accused of displaying a new condition, COVID fatigue. Every colleague who I've spoken to, nursing, medical, AHPs, ancillary staff, have felt insulted and hurt at the insinuations. It has damaged morale and made staff feel very unappreciated. Many were in tears, angry and frustrated. I was totally shell-shocked. I have worked so hard and made many sacrifices to ensure the patients received high standards of safe, effective care. This very much feels like a blame game. So much for collective leadership. I tried so hard to reinforce to colleagues that they are all doing a fantastic job, but thinking about the email's form of written words and connotations made me feel worthless, guilty, and potentially a danger to my patients, colleagues, and families. I feel very deflated.
A positive work environment, a busy environment, but great teamwork shown. Staff appear tired, but remain there for one another and for service users. There remains a strange, a different environment to what we have been previously used to. An element of challenge remains evident, however, close teamwork to ensure effective and safe service is provided to our families. We continue to work together to aim to continue to boost staff morale.
Working long days again after being redeployed to COVID ward. This week, I've been mostly with patient testing positive to COVID, admitted from nursing home, which is very challenging. Confusion and dementia added to the challenge of caring for these patients with COVID-19 symptoms. However, the ward I've been placed on has been very supportive. The importance of teamwork has a completely new meaning as continually having to walk through glass with baby monitors and walkie-talkies. All staff work together to help each other.
I can think of a number of experiences that happened throughout this pandemic. but one that has personally affected me is the number of deaths. Last week, I experienced 3 deaths in 24 hours. I find this challenging in many ways. The dying patient now has a different experience. With the no visiting policy, it is becoming increasingly difficult to ensure the dying patient is surrounded by loved ones in their last hours. The nature of these deaths are also extremely sudden, which is difficult to deal with from a nursing and a relative's perspective. I feel like the dying patient needs prioritised, now more than ever, to ensure they have the most comfortable experience. I also feel like the patient's relatives need communication more than ever, and that's something that we can manage as nurses. It is challenging both mentally and physically dealing with the number of deaths. However, as a nurse, my main goal is ensuring the experience isn't a traumatic one.
How do we meet the needs of patient education now? Spent the week trying to get the hang of MS Teams, discussing how we manage with patients with limited IT skills and staff who need practice and lack confidence within a service that needs to be up and running now.
Bombardment of or lack of information following COVID-19 vaccine and now positive residents and staff. Having to support both residents, staff and their families with little to no guidance and maintaining safety within the workplace. A level of uncertainty and lack of education with regard to same for care home sector. Not only is there the day-to-day running of the care home to maintain, with now increasing number of staff off isolating and lack of support from the trust due to likely the same issues.
SenseMaker is a tool that uses the lived experience of nursing staff to provide evidence that helps us to advocate for change. Many of the stories shared in this project have been harrowing and reflect the distress experienced by many. This first report is a historical record of nursing in Northern Ireland throughout the pandemic. SenseMaker also has had another important benefit. Many members have found that by thinking, writing, and anonymously sharing their thoughts, feelings, doubts and concerns, that this helped to process some of the pressures many of them felt on a daily basis. Thank you to Queen's University Belfast for bringing the stories in the SenseMaker project to life, representing and demonstrating the thoughts and feelings of nurses working in every sector of health and social care during this challenging and difficult time.